Hello friends, welcome back to my YouTube channel. So in today's video, we are going to discuss an important topic in forensic medicine, that is battered baby syndrome. So this is an important 5-mark question for all of us. Let's see that in detail. So the battered baby syndrome is going to be discussed under 6 topics, that is definition, features, clinical presentation, injury, diagnosis and cause of death. So battered baby syndrome, which is also called as cafe syndrome or cafe-Kempe syndrome or infant traumatic stress syndrome. So these are the other 3 names for battered baby syndrome. Next, let us see the definition. So a battered child is the one who has received repetitive physical injury as a result of non-accidental violence produced by parents or guardian. So the features, next let us see about the features. Features we are going to see of three categories, that is for the child, the parents and the precipitating factors. So the child who is commonly being battered presents under the following features, that is the child's age must be below 3 years, sex, it is more common in males than in females, the status of the child in the family, the status of the child is commonly the unwanted children, and position in the family is commonly the eldest or the youngest, not the middle one, either the first child or the last child. So these are the common things for the child. Next, let us see for the parents. So the parents who are battering their child commonly are young and unmarried couples, and educational status is generally low socio-economic status, low level of education. Their childhood history, that means the parents' childhood history itself will be like they would have been the victims of battering. They would have been battered by their parents, so they are battering their child. That's how it is. And then psychological factors, low tolerance threshold, impulsive, aggressive nature parents. So next, let us see about the precipitating factors. These are factors that make the parents batter their children. So these are commonly act of disobedience of the child, frequent crying that may cause annoyance, then refusal to take food, soiling of napkin or bedcloths. Act of child may annoy the mentally challenged father and mother. If the parents are mentally challenged, then it may then a small act of the child also may annoy the parents. Next, let us see the clinical presentation. So the child, when presenting to your clinic, it will present with the following complaints, that is discrepancy between the nature of injury and the explanation offered by the parents. Like the parents will say something and the injury might look entirely different. It will not be related to what the parents say. And then the second point is gap between the injury and the medical attention, which cannot be explained. So this is a clinical representation of a battered child. So if you see the eyes, cheeks, intraoral parts, ears, neck, inner aspect of arm, back especially on the body spine, groin and inner aspect of thigh and side of foot, all these parts will be injured. So next, let us talk about the injuries. So the injuries are often caused by hand, foot, stick, teeth, belt, shoe, hot water, cigarette, hot frying pan, etc. So the injuries are going to be classified into 7 types. So first, let us see about the surface injury that is present in the surface. So the battered child presents with abrasion, contusion, laceration, slap marks, lash marks, crunkle punches, pinch marks. Pinch marks generally presents with butterfly shaped bruise and traumatic alopecia. These are just the diagrammatic representation of each of these. So this is pinch mark, this is slap mark, cigarette burns on the sole, and then this is burn from the iron box, and this is bruise caused by next, let us see the injuries of the CNS. So the parent may wantedly vigorously shake the infant drop the child, vigorous shaking of the infant may lead to shaken baby syndrome or infantile whiplash syndrome, leading to intracranial hemorrhage. So, frequently, like vigorously shaking the infant may lead to intracranial hemorrhage. So, this presents with a triad called subdural hemorrhage, encephalopathy, and retinal hemorrhage. Next, let us see the eyes. So, the eyes presents with retinal hemorrhage. We already saw that in the triad here. Next is visceral injury. So, the injury to the spleen, liver, and hollow organs, shock and death of the child. Burns, small circular pitted burns due to cigarette. Skeletal injury, bony injuries including fractures, long bone fractures, skull fractures, rib fracture due to side squeezing, and also this is also called as knob fractures, string of beads or knob fracture. Next is metaphyseal region. So corner of bucket handle fracture is seen. Next is CNS, blunt trauma to the chest may cause multiple rib fractures leading to lung and heart contusion. Next, let us see the diagnosis. So, nature of injury, delay in seeking attention, recurrent injuries, and radiological manifestation, especially involving the ribs. All this can make us diagnose that it is a battered baby syndrome. And then, if the child dies, the cause of death may be due to head injury with or without skull fracture, intracranial hemorrhage due to shaken baby syndrome, rupture of abdominal viscus. So with this, I end today's video. Thank you so much, friends, for watching. If you find this video helpful, consider subscribing to the channel for more such videos. Also, do like and subscribe the video. Thank you so much.